welcome to Health is Wealth. My name is Joseph Kadri. On today's edition of the program, our discussion will be around the oversight visit carried out by the House of Representatives Committee on Healthcare Services to the Medical and Laboratory Science Council of Nigeria, MLSCN. So many areas, of course, we are looked into, and to the amazement of the committee, they were surprised how the registrar of the council, Professor Tostan Erhabor, was able to navigate his way and to ensure that the ethics of the profession is sustained despite limited resources. Okay, now, if you stay with me on the program, we'll quickly take a look at what the registrar says during the visit. Of course, he welcomed them, told them what the council stands for, especially looking at the act establishing the council, which is as far back as 2003, and the lawmakers actually frowned on it. I said, why will it be, since 2003, the act has not been amended. There are many, gray areas in the act that ought to have been amended. And of course, in a jet age like this, there are also issues, advancement in technology that, of course, would have been brought into the act establishing the council by way of amendment. And so the registrar welcomed the lawmakers, and what they heard actually marveled them. So now let's go straight into what Professor Tostan Erhabor outlined when he welcomed the...
It is with immense pleasure and gratitude that I welcome you to the Medical Laboratory Science Council of Nigeria, MLSCN House. Your presence here today fills us with a sense of overwhelming warmth and encouragement, especially at this crucial time. Your gesture is a powerful affirmation of the vital role the medical laboratory science plays in the nation's healthcare delivery system. We are deeply honored to have you here, that you have chosen to visit us, demonstrating your commitment to understanding and addressing the challenges and opportunities within our health sector. Your presence underscores the importance of collaboration between the legislative and the regulatory arms of government in ensuring standards of healthcare for all Nigerians. The medical laboratory science profession plays a vital role in the healthcare delivery system of our dear nation. We, at the MLSCN, are the regulatory body mandated to oversee the practice of medical laboratory science in Nigeria. Our core functions encompasses setting and maintaining professional standards that establish quality education, training, and professional conduct, especially those with the propensity of driving competence and ethical practice in the medical laboratory science space within the country. Licensing and registration of qualified medical laboratory scientists, as well as medical laboratories, to ensure they meet the standards of global best practices for quality and safety. Determine from time to time the standard of knowledge and skill to be attained by persons seeking to become medical laboratory scientists, medical laboratory technicians, and medical laboratory assistants. Regulating the practice of medical laboratory science in Nigeria. assessing and evaluating and registering foreign graduates of medical laboratory sciences, conduct examinations for technicians and assistants, inspection, regulation, and accreditation of medical laboratories, regulation of training of scientists, technicians, and assistants in any institution in Nigeria, as well as give periodic accreditation to such institutions. Provision and maintenance of separate register for scientists, technicians, and assistants. Regulation of the production, importation, sales, and stocking of diagnostic reagents and chemicals, and performs other such functions that may be conferred on her. Distinguished members, I implement the above mandates of functions through various departments, which include Office of the Registrar, CEO, Education Department, Practitioners Regulations Department, Health Laboratory Planning, Research and Statistics Department, Laboratory Inspection and Regulation Department, Foreign Graduates Department, National Laboratory Equipment Calibration Center, here at the headquarters, which is an ISO accredited facility, first of its kind in West Africa, in vitro diagnostic IVD labs department, domiciled in Lagos, which is also an ISO accreditation facility, first of its kind in West Africa. National External Quality Assurance Laboratory, domiciled in Zaria, with also an ISO accreditation, also first of its kind in West Africa. Other service departments are Finance and Accounts, Corporate Affairs and Administration. Dear honorable members, the challenges facing the healthcare sector today are multifaceted and complex. Emerging infectious diseases, antimicrobial resistance, non-communicable diseases, and ever-evolving technological landscape demand innovative and integrated approach to healthcare delivery. Medical laboratory science is at the forefront of addressing these challenges. Accurate and timely laboratory diagnostics is essential for early disease detection and diagnosis, which enables prompt and appropriate treatment, improving patient outcomes, and reducing morbidity and mortality. Medical laboratory science guides treatment decisions based on individual patients' characteristics and genetic profiles. Currently, Medical Laboratory Science Council Department is imparting her core mandate from various states, with our headquarters situated here in Abuja. Permit me also to state that we have 12 state offices spread across the respective geopolitical zones of the country. I'm happy to announce to you, except Kano, which is northwest, which we pay rentage, the rest are in government premises. So we don't pay any rentage. We are still moving forward to see that the Kano office is situated in any of the federal or state secretariats of which the state there are. Distinguished ladies and gentlemen, we believe that a strong and well-supported medical laboratory profession is essential for achieving universal health coverage, as well as the improving health and well-being of all Nigerians. We therefore seek continued support and guidance in the following area. Resource allocation. Adequate funding of the nationwide inspection against quackery. One of the most significant constraints we face in this is the lack of adequate resources, particularly in transportation. The MLSCN is responsible for conducting nationwide inspections of medical laboratory facilities and training institutions to ensure compliance with our standards. However, we currently lack the necessary vehicles to effectively carry out this inspection. In this line, we are now coming up with a newer model that will see to it that we are able to cover the country. And the new model is that the state will own this inspection activity, unlike what we are doing presently, where we go to the state, we spend 1 week, we come back. The labs that will close, we will not go back to that state again until about 2 years or so. And the monitoring is not all that effective. That's why we are coming up with this new model, that by the time the state and the federal join hands together and the state owns it, it will be a daily activity for those states to monitor those laboratories. These constraints severely impairs on our ability to discharge our mandate effectively. Nationwide inspections are critical for ensuring that medical laboratory services meet the required standard and for identifying and addressing any deficiencies. Without adequate transportation, we are unable to reach all the facilities and institutions that require our attention, potentially compromising the quality of healthcare services provided to Nigerians. Therefore, we humbly appeal to the distinguished members of the House Committee on Health Services to consider our plight and provide the necessary support to address this critical need. We believe that with your assistance, we can overcome these challenges and further enhance our contribution to the nation's healthcare system. We are grateful for your time and attention. We trust that this visit will provide the honorable members valuable insight into the crucial role of medical laboratory science in nation health development.
Professor Tosan Erhabor there outlining the operations of the council, which of course has 11 state offices, including the FCT, making it 12. Ordinarily, if there's resources, the council ought to oversee the entire nation and of course have offices in the entire nation, and which of course he specified in that comment where he said there is need for some kind of increase in the budgetary allocation to the council so that the council can actually expand its scope and ensure that the profession has those that are qualified and also tackle quackery. The issue of quackery is not only related to the practice of medical and laboratory science, but it cuts across every other sphere. But for the medical laboratory practice, there ought to be zero tolerance for malpractice and quacks, because medical doctors rely on the results churned out from the lab. Accuracy of the result will, of course, gives you accuracy of the prescription. If you have misdiagnosis, the prescription will also be missed. So much must be done to ensure that the practice has zero tolerance for quacks. Now let's hear what the chairman of the House Orientative Committee on Healthcare Services, Honorable Amos Magaji, has to say in his opening remarks, and after that he also yielded the floor for his members to also chip in and ask some questions. So now let's take a look.
The medical laboratory diagnosis is key to providing healthcare delivery, quality healthcare delivery. Before a doctor will prescribe any medication, without guessing, the result from the lab is the accurate pointer to whatever ailment the patient is suffering.
Yes, sir.
So if the result is misleading, it can also mislead the doctor. For example, a patient goes to the hospital and then you say the cholesterol level is low, high, or is at the average. And then, for example, if the cholesterol is high and then there is no detection from the lab and then the report came that the cholesterol is okay, and the person is moving around thinking his cholesterol level is fine. The next thing you see is that the person is having cardiac arrest or any vascular related problems. What do you do to ensure that standards are maintained with the little or the few staff that you have across Nigeria?
First of all, let me commend the account department for the presentation of this annual. Whether you are not, you don't know anything about account. If you see this, I think you can understand something. Yes.
How is the council working with NAFDA? Because I know NAFDA has a lot of laboratory that they test the product, drugs, and so many things. How is the council working with NAFDA in ensuring quality control as well?
Yeah, you've heard it all from the chairman of the committee as well as his colleagues. What we can vividly deduce is the fact that they were satisfied with the operations of the council, and so they were taken to a guided tour of the facility of the MLSCN, where they visited the Biosafety Center, also the NALEC Center. And then after that, they all gave their concluding comment on the outcome of the visit.
Are you from Edo or Malaysia? Yeah, but there is a base in
Only one.
when they come, what are they assessing?
No, those we are going to recruit here for the training. So they will set example.
I don't understand. How can you just be looking at, the Americans don't come, all of us should rise and say, look at it,
regulatory agency, the council here just to check what they have, and then on our constitutional mandate, the oversight. And then, of course, we came here to look at their calibration, and then this training center. And then, of course, a lot of issues have come up here. For the calibration center, the registrar just informed us that they've done everything to make sure that they are in the trade portal in Nigeria, and I think that is important because we are working to ensure that lab results, medical lab results from Nigeria should be accepted anywhere in the world. And if a sample is taken from Nigeria, investigated here, and the same sample is taken to any part of the world, we should have the same result so that our result here will be credible. We are tired of Nigerians traveling abroad to other countries for just having their medical checkup, which we can do it here. We have the manpower, so we just want to build the capacity and ensure that any result from this part of the world or any lab in Nigeria should be credible, should be trustworthy anywhere in the world. And then, of course, there are also the issue of equipment. We don't want Nigeria to be a dumping site where any type of manufacturer will just bring any equipment here and dump them. Perhaps these are some of the reasons why we are having erroneous results in tests conducted in our labs. So this agency has been saddled with the responsibility of accrediting or inspecting every equipment, determining the quality of an equipment that is used here in our laboratory. But they have not been carrying their function because of hitches here and there. So we're saying that we're giving a marching order that it should be that any equipment that entered this country to be used in any lab, to be sold in Nigerian space, must be validated, must be calibrated to be ensure that that material or equipment will be able to deliver
What is supposed to do.
what it's supposed to do, and that's why we're here. And the registrar was just telling us that they have not yet been included in the trade portal, and we think that should be done immediately if we don't want to be. And of course, doctors depend on laboratory results for treatment and for further investigation. So if the laboratory results that are coming from labs in Nigeria are faulty, are erroneous, then we'll be doing wrong diagnosis and wrong treatment.
So what are you taking, and what will you be doing differently, your committee members?
Of course, that's what we're saying. First of all, for equipment, they should be enrolled in the trade portal. Then secondly, this agency must have offices all over the federation, and the budgetary provision should be given to them, because you see, their duty most time is monitoring. We have quack laboratory everywhere in this country. Some of them are not trained. They carry out different results. Sometimes when you see some laboratory results, you can only but laugh. And because they don't have the manpower to man this vast land called Nigeria.
So on the area of accreditation, sir, how do you intend to approach it so that public-private facilities should be able to subject their facilities?
That's what we're saying. Apart from that, one, to accredit the members, those that have been trained, to be sure that a lab scientist in Nigeria can practice and can be depended on anywhere in the world. That's first. Number two, those also practicing and opening all laboratories must also be assessed to ensure that they are of standard to deliver the right result. And they cannot do it as an agency saddled to do that without the manpower, without the resources. And we just discovered that they are present in only 11 states in Nigeria. That's 12, including Abuja. And we have 36 states in Nigeria. So immediately we asked them that they should go and look at modalities of how to expand and then strengthen their workforce.
At least some of the constraints we've opened up to them, and they've given us some timelines.
What are those constraints?
Like getting people trained for biosafety in Nigeria, where we don't even have people in Nigeria, that they will be able to liaise with the CDC America to send someone to come and certify this center. In calibration, they've also seen that because of national attitude of our suppliers, our manufacturers, they come and dump equipment in Nigeria. We have also told them, yes, that is why we established this facility by safety cabinet, national quality laboratory accreditation certificate of place, but the uptake is low. By the time we are now going to be on the portal, one of the constraints, by the time Nigerian MLSCN is on the portal, trade portal, we will now get to know once the equipment is leaving the manufacturer, is coming to this country, via our system here, we'll be able to say this has been validated or this is not validated, so it cannot come. The scenario is just that what happens during COVID. COVID, there were so many kids that came into this country for rapid testing. But when we finished the validation, the first 20 did not pass. It is when we insisted that this is the percent, this is what we want for our citizens, that we could only approve 2 that it was used during that COVID time, and Nigerians were free. Yes, with what they've seen, the manpower, we are just less than 250. How can we cover the country? We don't have vehicles. If there's no allocation, we cannot. We've tried all we can, but they don't put us on vehicle list. That portal, we cannot get any vehicle from that place. Then they are asking us, have state offices. How many staff do we have that can cover the state? With their presence now, they now know that if we tell them that we are looking for 300 staff to be employed, they will help us push it to IPPIS, through IPPIS and budget, and government will approve it and will get that employment so Nigeria can get the quality service this organization is set up to do. Thank you, sir.
All right, you heard it all. Very, very clear. There's a need to ensure that the results, the medical laboratory results from Nigeria is accepted in any part of the world. It's a standard the lawmakers want. It's a standard the registrar of the council has been, carrying out. It's a standard practice, which is why the MLSCN has got 3 international ISO certification, and we only hope that when the lawmakers return, they will look at areas, gray areas, to address, to amend, so that the council will have unhindered access to ensure that facilities, be it public or private, subject their facilities to regular accreditation in such a way that whatever result they churn out will be accepted in any part of the world. This is where we wrap up to this edition of the program Health is Wealth. Until I come your way again, Joseph Kadri is